What up? It's the PAC, man. All things physician assistant. Man, in this video, I got a question yesterday with regards to specializing fresh out of school versus generalizing fresh out of school. And I thought, man, what a really good question. And for myself, I've kind of done both in a very short amount of time, as I came fresh out the gate from graduation. I went right into, well, the first 3 months I did pain management, and then I realized, yeah, this is not for me. It's too sketchy. But so then right after that, I went right into ENT, and then ENT, I was like, man, I love this. Like, I feel like I'm the master of my ish. Like, I have my classmates, my friends reaching out to me. They're working in ER, urgent care setting, anywhere, and they're reaching out and they're saying, hey, ENT question for you. I got this kid in the ER. What do you think? I'm like, well, based on, American Academy of Otolaryngology, this is what the guidelines suggest. And I just felt like, this is my niche. Like, I'm the master of it. So it felt good. Quite frankly, I think if I would have ended up in any specialty, cardiology, pulmonology, gastroenterology, I would have felt the same. I would have just felt like I'm the master of my ish. So I was there for a year willing to retire there. I had no intentions of ever leaving ENT, and then COVID happened, and I got furloughed for 90 days. I always had, even while working ENT, I always had my supplemental income on Saturday mornings. I had a family medicine spot that was treated like an urgent care on Saturdays. So I did my little urgent care dabble here and there. Pediatric urgent care was my thing for the weekend. And since they, during COVID, they say, hey, we're fully operational over here, so if you want to come on down, we're not shutting down for COVID, so if you want to come on down and keep working, we can use your help. I said, you know what, I'm furloughed, I'm not doing anything, why not? So I started doing that. By the time ENT called me back and said, hey, you can come back now, I was like, yeah, I'm family medicine. They're like, what, are you serious? I was like, yep. I feel like, this place, I feel a lot safer in a place that it's not affected by COVID. Anybody could be affected by COVID, with the country shutting down. There's no point in having a specialty office open if nobody's referring at the moment. But either way, my experience going from a specialty to family medicine was quite challenging in the beginning, partly because I felt as if I've lost a lot of the medicine that I've learned in PA school or studied for the PANS preparation. And I was so ENT focused that, the first patient I had in DKA or A1C greater than 14 or complete metabolic syndrome or hypertensive, emergency, I felt like, gosh, I'm not really, like, I'm not gonna drop the ball. I'm gonna make sure I seek counsel, and I asked for a lot of help in the beginning, make sure that I could provide the best possible care for this patient. But ultimately, I felt like, why is this so foreign to me right now? So I felt like I was regardless of if I already had that year and a half of experience, I felt like I was a new graduate. And either way, I was still a relatively new graduate, but I felt like I had absolutely no experience whatsoever. I was very comfortable with patients in ENT, but walking into a room and where the lab results are all over the place, patients super hypo or hyperthyroid, and I'm just thinking, wow, like, guidelines say? I'm not entirely sure. I only had to focus on one guideline. Now I felt like nowadays I'm reading, American Academy of Endocrinology, Cardiology, American Heart Association. What do people have to say about diabetes management and thyroid management and hypertensive management? And I just feel like I'm constantly reading multiple guidelines, just trying to update myself with what's the best, clinical approach to my patients. And so it's a massive learning curve, and I believe that if you're a new graduate or soon to graduate and you're not sure what type of medicine you should practice, my recommendation, and I'm just one person, would be to generalize as much as possible and learn the medicine. We all come from backgrounds, for the most part, as PAs. Some of us were nurses, worked in PT, OTs, respiratory, surgical techs. We all have this story that we bring, this experience that we bring to the table, firefighter, paramedics, and we have this experience that we bring to the table. But at the end of the day, PA is a whole new level of it's a whole new level altogether. It's what you bring to the table certainly contributes to your critical thinking skills, but it's new. It's practicing medicine is new, and so just that we got to learn to practice medicine. And sometimes if you niche right away into a specialty, you lose that ability to manage patients medically. And so examples of general medicine, of course, would be family medicine, anything primary care, so internal medicine. Even pediatrics is a generalized medicine for the pediatric population. Even if you work for hospital settings, ICUs, intensivists, hospitalists, internists. ER is a general medicine, but it's general, very acute subspecialty. Great pay, great hours if you're into shift work, high stress but well compensated specialty, but specialty nonetheless, in the sense of your job is to stabilize and move out. So you lose, to an extent, you lose the ability to manage patients. If someone comes in DKA state, you give them fluids, you get their sugar down, stabilize them, and then refer to PCP or endo to manage them. So you lose that ability to manage someone if all you're doing is constantly stabilizing. But certainly ER is on the top of that list as well of specialties to consider fresh out of school. So I guess that's my message for today, and I hope whoever's hearing this, whether you're a recent graduate, soon to graduate, or even considering the profession, wherever you're at in your process, consider general medicine. Learn the ropes, learn the basics, and then you could fade out and zoom in wherever you like later. Peace.